Did you know that many types of cancer show signs in the body that are often ignored, especially by women? Statistics reveal that 1 in 3 women worldwide will receive a cancer diagnosis in their lifetime. Even with medical advances, early detection remains one of the most important factors in saving lives. But what happens when these signs are overlooked? The truth is, some symptoms may seem harmless, like persistent fatigue or a small change in the skin. However, these seemingly minor signs can indicate a much bigger issue. Today, we're going to cover 7 cancer symptoms no woman should ignore. By recognizing and understanding these signs, you'll be much more prepared to act quickly and protect your health. Before we dive in, have you already liked the video? The more likes, the more YouTube shares this video with people who may not have easy access to doctors or hospitals. And please, share this video with your friends and family, especially the women in your life. This simple action could save a life. Also, tell me, do you have any health concerns or are you worried about a specific symptom? Drop it in the comments and let us know where you're watching from. Now let's get started. First symptom, abnormal bleeding. Bleeding outside of the menstrual cycle may seem like a common issue, but it's actually one of the most concerning symptoms of gynecological cancers, such as cervical and endometrial cancer. This type of bleeding can happen between cycles, be extremely heavy, or even occur after menopause. However, most women attribute these signs to hormonal imbalances, delaying a visit to the doctor. Ignoring these signals can be a serious mistake, as early diagnosis of these cancers is crucial for effective treatment. Also, pay attention to the intensity and frequency of this bleeding. If it's heavy, prolonged, or accompanied by pain, don't ignore it. A simple gynecological exam, such as a pap smear, can identify changes in the cervix before they turn into something more serious. Another key test is a transvaginal ultrasound, which provides detailed images of the endometrium and other gynecological structures. Detecting these changes early can make all the difference, ensuring a less invasive treatment and a greater chance of recovery. Second symptom, unexplained weight loss. Unintended weight loss can be one of the first signs of cancers in areas like the pancreas, esophagus, stomach, and lungs. This symptom occurs because the body uses a lot of energy fighting cancer cells, leading to rapid weight loss. Losing weight without changing your diet or activity level may seem like a pleasant surprise to some women, but it's actually a warning. The problem is that most people attribute this weight loss to stress or other external factors. If you're losing weight without reason and it's accompanied by other signs like weakness, loss of appetite, or fatigue, it's essential to undergo more specific tests. A blood test, like a complete blood count, can reveal changes in cells, while imaging tests like CT scans or MRIs help detect suspicious areas in the body. These tests not only reveal the presence of cancer, but also show if it's in its early stages, increasing the chances of effective and less aggressive treatment. Third symptom, lumps or masses in the body. A lump, especially in the breasts, is one of the most common signs of breast cancer, but these lumps can also appear in other areas like the neck, armpits, and groin. When palpable, these lumps may indicate the presence of tumors and, in some cases, are accompanied by pain, shape changes, or tenderness. Many women ignore these lumps, thinking they're just cysts or unimportant growths. However, even small lumps deserve attention, especially if they persist for more than 2 weeks. Self-exams are essential tools for detecting these changes, but it's important to supplement them with mammograms, recommended annually for women starting at age 40 or earlier if there's a family history. Breast ultrasound is also an effective alternative, especially for denser breasts. Detecting a tumor while it's still small, before it spreads, greatly increases the chances of a cure and allows for less invasive treatments. Fourth symptom, changes in bowel habits. Changes in bowel habits, such as persistent constipation, diarrhea, or blood in the stool, may indicate colorectal cancer. Many people assume these symptoms are due to temporary digestive issues or diet, but if these changes persist for more than a few weeks, they warrant attention. The presence of blood, in particular, is a major warning sign and should never be ignored. A colonoscopy is the most recommended test to detect lesions in the large intestine and rectum. This procedure allows doctors to not only see potential tumors, but also remove polyps, which are precancerous growths, before they become malignant. The fecal occult blood test is another important option, as it can detect tiny traces of blood not visible to the naked eye, potentially revealing early-stage cancer. Fifth symptom, persistent cough. A cough lasting more than 3 weeks can be a red flag for lung cancer, especially when accompanied by symptoms like chest pain, hoarseness, or shortness of breath. This cough is often mistaken for allergy or cold symptoms, but it's important to remember that lung cancer can affect even those who have never smoked. This type of cancer is one of the deadliest because it's often detected in advanced stages. To investigate a persistent cough, it's best to start with a chest X-ray, which can reveal lung abnormalities. If there's a suspicion, a CT scan provides a more detailed, precise analysis. If needed, a bronchoscopy can be performed to examine the lung's interior and collect samples from the airways. Detecting lung cancer in its early stages can significantly increase the chances of cure. Sixth symptom, skin changes. Skin changes, such as spots or moles that grow, change color, or shape, are some of the most common signs of skin cancer. Women living in areas with high sun exposure have a higher risk of developing this type of cancer. Even though spots and moles may seem common, it's crucial to monitor any changes, and at the first sign of alteration, see a dermatologist. Tests like dermoscopy, an imaging exam of the skin layers, help differentiate between benign and malignant lesions. Additionally, a skin biopsy may be necessary to examine any suspicious changes. This kind of vigilance allows cancer to be detected in its early stages, enabling more effective and less invasive treatments. Seventh symptom, constant fatigue and weakness extreme. Persistent fatigue is a common symptom in various cancers, such as leukemia and lymphoma. This type of tiredness doesn't improve with rest and comes with a constant sense of weakness, along with possible fevers and weight loss. This sign is easily dismissed, as it's often linked to stress or daily overload, but when it persists, it's a cause for concern. A complete blood count is one of the first tests to investigate the possibility of blood cancer, revealing changes in blood cells. In addition, a CT scan can help identify lumps in other parts of the body, like enlarged lymph nodes. If the fatigue is accompanied by other symptoms, like night fever, excessive sweating, or loss of appetite, it's important to consult a doctor for a full evaluation. Taking care of your health is the best form of prevention, and when it comes to colorectal cancer, specific exams can help detect issues before symptoms appear. A colonoscopy is one of the most recommended tests, especially for those aged 50 and older or earlier if there's a family history of colorectal cancer. This exam allows the doctor to directly visualize the inside of the intestines and rectum, identifying suspicious changes and removing polyps, which can be precancerous lesions, before they turn malignant. Another preventive test is the fecal occult blood test, which detects small particles of blood in stool that are often invisible to the naked eye. This test is quick and simple, and it's recommended annually or is advised by a doctor. This test can reveal early signs of cancer or other changes in the intestine that require further investigation. Early detection greatly increases the chances of effective treatment, reducing the risk of serious complications. Don't underestimate these exams. They're powerful tools for prevention. Of course, if you think you might have a health issue, have noticed several signs, and have some of the symptoms I've mentioned, consult a doctor, explain your concerns, and follow their guidance. Did you enjoy the video? Don't forget to share it so that more people can benefit from this information. And what's the next video you'll be watching? I'll leave some recommendations so you can keep learning.